Do you know vaginal yeast infections? They are quite common in young people, so it needs a lot of care during the cycles. Hi, I'm Dr. Jyoti Rana, Principal Consultant at Max Hospital, Dehradun in Obstetric and Gynecology Department. What's vaginal yeast infection? Vaginal yeast infection, medically also known as vaginal candidiasis, is caused by a fungal infection caused as Candida albicans. There's always a balance between the bacteria and the fungus in the vaginal epithelium. Whenever there's a disruption in this balance, it definitely leads to the vaginal yeast infections. What are the causes of vaginal yeast infections? The most important cause of vaginal yeast infection is the overuse of antibiotics. Over-the-counter use of antibiotics can alter the ratio between the healthy bacilli and the fungus, not only in the intestinal flora but also in the vaginal epithelium, thus leading to the overgrowth of vaginal yeast infections. Number 2, immunocompromised conditions like diabetes, hypertension, sexually transmitted diseases like HIV, and even in the pregnancy where the immunity is diminished can lead to vaginal yeast infections. Number 3, excessive douching, where various V-washes are used to flush the healthy bacilli. The lactobacillus present in the vaginal epithelium can in turn lead to the vaginal yeast infections. What are the symptoms of vaginal yeast infection? The most common symptom is vaginal discharge, which can vary from simple watery discharge to cottage cheese discharge, which mostly the patients complain. There's vaginal soreness and vaginal pain. Then there is intense itching in the perianal areas and the perivaginal areas. There's lower abdominal pain and the pelvic pain. How to diagnose this vaginal yeast infection? Main part of the diagnosis is the presentation of the patient, and second is the per speculum examination, where the patient needs to visit a health officer or a gynecologist, and a speculum examination is done to see the discharge and see any inflammation or soreness around the area and to be treated accordingly. How are these vaginal yeast infections treated? These infections, once diagnosed, are treated with antifungal creams. There are certain antifungal capsules which are inserted vaginally for a duration of around 1 week and repeated after around 15 days. There are certain antifungal creams which are given for vaginal soreness, inflammations, to be applied on the affected areas. So as we have discussed about the signs, symptoms and the diagnosis of vaginal infections, now we'll come to the prevention. As you know, prevention is better than cure. So coming to the prevention, important thing is to stop overuse of antibiotics, because that will kill the lactobacillus and definitely will cause the overgrowth of the yeast infection. Number 2, all the health issues like diabetes, sexually transmitted diseases, hypertension need to be addressed with your healthcare professional. And number 3, which is very important, that you should avoid excessive douching of the perineal and the vaginal areas. Now, if these steps are taken care, definitely the recurrence rate will be less. And some more important points to add to stop the recurrences: a healthy lifestyle, where daily routine of physical activity is must. Stop or decrease the use of refined carbs and sugars, and to take care of your urinary tract infections. For that, public loos that shouldn't be used much, and the area needs to be kept as dry as possible to avoid the overgrowth and the recurrence of the infection. To conclude the vaginal yeast infections, I want to emphasize that it's a treatable condition and there is no need to fear about it, or rather you should be outspoken about it. Get yourself examined by a gynecologist or a healthcare professional and get treatment at the same time. Because if it's not treated at the right time, it definitely will lead to certain complications like pelvic inflammatory diseases as well as future subfertility or infertility. And in the long run, you never know, sometimes the cervical cancers. A little piece of advice for the young couples or the young boys and girls, that when you are sexually active, you need to be taken care with the contraceptions, especially the barrier contraceptions, because then the chances of having the vaginal infections are quite common, and for that time you both need to be treated at the same time. Then in the cervical cancers, which is also a subsequent further part of the vaginal yeast infections, needs to be taken care with the cervical cancer vaccines. All the young girls as well as the boys can have cervical cancer vaccine for the prevention of the cancers. 3 doses of Gardasil or Cervarix can help you out. So it's right time you be outspoken about the vaginal yeast infections and the cancers and the issues which are related to it. Get yourself examined by a gynecologist and get the treatment at the right time. Thank you so much.